as women are so concerned about that scar, how do you to create that scar so that they have a pencil line instead of a great big thick healing process?
Well, that's the other point too. So not only do we want the scar to be hidden and inconspicuous that way, but we also want it to be as thin and fine as possible.
Right.
And I think there are a couple of technical points that we can do as surgeons to help that. I mean, in some cases, the scarring is determined by the genetics of the patient. There are certain patients' skin types and familial history and stuff like that that may determine part of their scar characteristics, but I think we can do some to help that too. And you know, basically, if you think about what results in a wide or a thick scar, it's mainly a tension on the skin and on the skin itself, the dermis and the epidermis. And the more we can alleviate tension from those parts of the skin, the better our scarring is going to be. So what I do personally is I do a layered closure. I think most surgeons do something like this, but there is a layer of tissue underneath the skin and the fatty layer that's really strong, and I put all the tension of the repair with some really large size sutures and do them individually and carefully align everything as I'm going, stitch by stitch. I do this all myself. I don't have assistants doing it. It's a tedious process, but to get that scar lined up just so and to optimize the appearance of the scar, I think you have to do it. And then when you do that, all of the tension is alleviated from the skin, and the skin just kind of lays together. And then you just very, very carefully, again, very meticulously, get the skin closed back up so that you have as little exposure of the dermis. You try to just make that epidermis line right back up as closely as you can, and so it almost should look like a scratch at the end of the operation.
Wow.
And if you do that, you'll wind up with a very thin scar.